Why are inappropriate shocks a problem for heart failure patients? Among heart failure patients, ICD shocks are associated with a 2 to 5-fold increased risk of death. Each inappropriate shock causes further damage to the patient's already compromised ventricles, increasing the risk of mortality. To minimize the rate of inappropriate shocks, an ICD needs to effectively discriminate between life-threatening ventricular arrhythmias and atrial fibrillation or atrial tachycardia. Dual-chamber ICDs are best placed to execute this type of discrimination thanks to dual-chamber sensing. However, implanting a dual-chamber device may not be ideal, as it could lead to unnecessary pacing in the right ventricle. For heart failure patients, long-term right ventricular pacing increases the risk of death and hospitalization for heart failure. The question is, how can we protect the patient from inappropriate shocks without incurring the unwanted side effects caused by excessive right ventricular pacing? The solution offered by Sorin Group is to combine two proven algorithms, PARAD Plus and SAFAR. Ahead of its time, PARAD Plus was the world's first dual-chamber discrimination algorithm. Not only was it the first, it has set the standard in the effective differentiation of supraventricular arrhythmias from ventricular arrhythmias. SAFAR is a complementary smart technology designed to identify all different types of AV block and only pace the right ventricle when strictly necessary. The efficacy of the PARAD Plus SAFAR combination was assessed in the OPTION study. OPTION was a randomized study comparing two groups. Group 1 received standard single-chamber ICD therapy, and Group 2 received optimized dual-chamber therapy with PARAD Plus and SAFAR. OPTION was a prospective, multi-center, single-blinded study. Any patient with standard ICD indications according to guidelines was eligible for inclusion. The objectives of the OPTION study were to assess the effectiveness of Sorin ICD dual-chamber detection in avoiding inappropriate shocks, and SAFAR in avoiding the deleterious effects of right ventricular pacing. 462 patients were enrolled in the study and followed for 2 years. The clinical endpoints of the study were the time to first inappropriate shock and the percentage of right ventricular pacing in both groups. At 2 years, it was found that in the dual-chamber ICD group, there was a significant 58% reduction in inappropriate shocks compared with the single-chamber therapy group. The study also showed that ventricular pacing in the SAFAR group was limited to 3.9%, which was similar to the single-chamber group with 2.4%. Investigators in the OPTION study concluded that dual-chamber ICD therapy with PARAD Plus combined with SAFAR produces a net benefit by reducing inappropriate shocks without any deleterious effects associated with right ventricular pacing. By combining Sorin Group's SAFAR and PARAD Plus algorithms, we can expect to give patients a better outcome.